mental illness in relation to the physiological structure of the brain, neural pathways, or is it to do with, hormones and so forth? And what is then the diagnostic process that people undergo to know that you are clinically diagnosed with this mental illness?
Sure. That is a bit of a complex question, but I'm going to try and unpack it as best as I can. So when we look at the diagnostic procedure internationally, because obviously in South Africa we also use the same classification and diagnostic methods. So we use two resources, and the number one is the DSM, the Diagnostic Statistical Manual of Mental Disorders, the DSM-5, currently text revised, and the ICD, the International Classification of Disorders Manual. So when we undergo or when we engage in the diagnostic process, we typically look at the presenting symptoms. So this will be what is being reported by the client or the patient to the practitioner. So our diagnosis would primarily look at the presenting symptoms. But then if you go deeper, if we need to go further investigation, for example, your psychiatrist might order blood work to see what is happening in the individual in terms of their hormones, in terms of their liver functioning, all those things. So what that means is the diagnostic process is a bit more complex. Yes, does it have to do with hormone imbalance? Some of it has to do with hormone imbalance. Does it have to do with serotonin imbalance in the brain? Yes, definitely. We know that depression is primarily caused by serotonin issues, which is then addressed by antidepressants. But does it have to do with psychosocial issues? Absolutely. So the biggest aspects of diagnosis and the biggest aspects of mental illness for most individuals has to do with psychosocial issues or psychosocial conditions. And the minute we address those conditions, what we see is most individuals will start showing less and less, or their symptoms will start to wane and they experience less symptoms compared to individuals that are treated by medication alone. So it really depends on each individual. We take it case by case to see what is happening with the individual. Is it more genetic? Is it more hormonal? Does it have to do with your neurotransmitters and all those things, or does it have to do more about the psychosocial environment of the individual? And then we treat the individual according to that data or that information.